So why is BC under still a sort of lockdown, a kind of house arrest? Well, I'm not the only person asking that. Our friend John Carpay, the executive director of the Justice Center for Constitutional Freedoms, is asking that. In fact, he's going beyond asking it. He is challenging the lockdown measures in a new analysis called Benefits Assumed, Harms Ignored. And John Carpay joins us now via Skype. John, great to see you. I'm so glad that you are fighting for civil liberties in the era of the pandemic. Too many people are afraid to even say, hey, what are we doing? This is madness.
We asked Prime Minister Trudeau and all the premiers, all of the chief medical officers back in April, so we're talking 3 months ago, what are the projected anticipated harms of the lockdown in terms of anxiety, depression, alcoholism, drug overdoses, spousal abuse, child abuse, suicides, people driven to despair, and less money being available to pay for healthcare once we cripple and quasi-destroy our economy. Because I wonder how many people are going to be marching in the streets 6 or 12 months from now when governments cut healthcare spending by 20% because we're broke, because we destroyed our economy. What are the costs? What are the costs of the canceled surgery? How many people have died because hundreds of thousands of surgeries all across Canada, including British Columbia, have been canceled? And 3 months later, not a single response to any of these questions. And so the politicians are assuming benefits and they're ignoring harms.
You know, I know exactly what you're talking about. I bumped into a doctor the other day who said that Toronto's leading cancer care clinic says that their backlog will take them 5 to 8 years to catch up. I said 5 to 8 months? No, he said 5 to 8 years. It's just incredible. Of course, we all know from other economic studies that unemployment is directly tied to suicide and things of that sort. I think that in places like BC that mercifully had a lower death toll on the virus, I think we've probably exceeded that, and certainly in other jurisdictions too. So you've produced this charter analysis. Are you doing any litigation in support of it, or is this just trying to impact the public discussion?
Well, we will be filing court challenges in future if the politicians don't come clean and do what they're supposed to do under the charter, which is to provide evidence for the claim that the lockdowns have saved thousands of lives. You hear it repeated like a mantra over and over and over again, just the same way they talk about evidence-based public policy, they talk about science, and they talk about the lockdowns have saved thousands of lives. Well, I'd like to see the evidence for that because making an assertion is not evidence. And on the harm side, the charter allows governments to violate our fundamental freedoms to move and travel, associate, assemble, worship, provided that they demonstrably justify these measures as reasonable in a free and democratic society. Now, there's complicated tests that you're aware of, the Oakes test with rational connection and minimal impairment, and it's a very complicated test. But the gist of it is that the governments need to demonstrate that any law, policy, regulation, health order that violates a fundamental charter freedom, like our freedoms to move, assemble, associate, travel, worship, any law that violates charter freedom needs to be demonstrably justified as bringing about more good than harm. And politicians in every jurisdiction have failed miserably and continue to fail in actually demonstrating that the lockdown has caused more good than harm, which is what they need to demonstrate in order for those measures to be valid.
You know, as you may know, I published a book about some of these matters, and I looked at the original modeling that Justin Trudeau relied on, and there were different scenarios in his model. The best case scenario was 50,000 deaths. The worst case scenario was 350,000 deaths. I mean, 350,000 deaths is a stunning large number. That truly would be scary. But it turned out that the actual number was around 9,000. And even that is misleading because 80% of those were seniors, in particular seniors' homes. So it's not even just if you were over the age of 80. Even that didn't mean you were doomed. It was particular group settings, close settings where hygiene wasn't in place. So, first of all, I think there was a single person under age 20 in the whole country who passed away, and that person had a terminal case to begin with. I mean, province by province, the number of people under 50 who have passed away from this is single digits. And to know that we've shut down our schools, our jobs, because a handful of people, typically average age 83, passed away. And I'm not saying I'm happy that the average age is that high, but now that we know it's that high, we can focus our care on them. We don't need to shut down everything else. We can focus all our protection and care on the people at risk and let the rest of us go back to normal life. I don't know, I find it appalling that no one's willing to talk about this. You're one of the few who are.
I wish there were more people just voicing that, because unfortunately, fear is very powerful, and the politicians and the chief medical officers scared Canadians into a state of fear in the months of March and April. You mentioned Trudeau's figures of at least 50,000 deaths, possibly 350,000 deaths, actual number 9,000. The same thing in Alberta. Jason Kenney said that as many as 32,000 Albertans could die in a province with just over 4 million people. 32,000 deaths is the fear-mongering that Jason Kenney engaged in. And now the actual number of deaths is approximately 160, with the average age of death being in the low 80s. And, youngest person to have passed away was 27 years old, and that was someone with other pre-existing serious health conditions. So it's just disgusting how this fear-mongering is still persistent. The lockdown could have been justified for a week or two, or maybe even 3 or 4 weeks, if the goal was truly to flatten the curve. It could have been justifiable in March or April, but to prolong this into July and to throw people into unemployment and poverty and despair and suicide, and to destroy the prosperity that we need to actually pay for healthcare, and to delay treatments for cancer patients, cancer diagnosis, cancer treatment being delayed. It is unconscionable for any province to be continuing with this lockdown now that we're into July. It is unconscionable.
That's an excerpt from my daily show, The Ezra Levant Show. Every day I do a monologue on the news of the day, then I interview an interesting guest, and then I read my hate mail. You gotta subscribe. Go to rebelnews.com.